Hello everyone and welcome to another live video here with Dr. John Butler and myself Idan, Hypnotherapy Training International. And today, John, we would like to talk about, let's say, 3 common myths which people have about hypnosis.
Yeah.
I know the usuals are, you're going to knock me unconscious, I may not wake up, I may reveal things which I don't want to, I may forget certain things about the past which happened, there might be side effects. What kind of things do you find more common people are asking, and how can we dispel them?
Well, thank you, Idan. Well, if you're talking about common myths, those are certainly among the most common that people have. I would say it comes from a misunderstanding about hypnosis, that you are not aware. A model of hypnosis of being unconscious. And in that state, and it's linked with the idea that hypnosis is sleep, so I don't know what you're saying, I won't know what you're doing, and I won't have control then. And I may reveal my secrets, you may control me and get me to do things I don't want to do. I won't have free will, I'll lose my willpower to know and control what's happening. And so that's a very common perception about hypnosis, misperception. I mean, there's many misconceptions because it's such a complex phenomenon, and debates among the academic community with theories about hypnosis. But if we're talking about among the general public, that I won't know what you're doing and I won't have control, and that fear of losing control then causes people to fear going into the state. And as I say then, the associated fears that I may be revealing things or doing things I don't want to do, and you will have the power over me. So there's 3 main areas of fear. Again, based on misconception.
So are you able to focus for a second about the fear that I may do things or reveal things which I don't want to?
Of course, when we work with a client, when we are doing therapy work, we make sure we deal with those kind of perceptions. We help them to look at the situation, at the research about hypnosis, the clinical uses of hypnosis, which shows that this is not the reality of the state of hypnosis. I mean, it is a complicated issue between ourselves, if we are looking as therapists and researchers about hypnosis, how much can people be influenced, and what are the driving forces for them to accept or reject certain suggestions. That's a complex area, and we would be here discussing this for a long time. The nature of will, free will, of the nature of what's going on in the subconscious when you give a suggestion, and whether it will accept or reject it. So there are many, many complexities. But to dispel the myths with people is the start. And you point out that these are dramatizations of hypnosis, largely from books, magazines, films over the years, which have what's called in the land of theatre dramatic license. By poetic license, you can exaggerate, distort to a degree the phenomenon for the purpose of making a good story.
Sure. And
we had Svengali, the character in the Trilby novel, which is one of the first, probably the first representation of hypnosis, the modern Western form of hypnosis, to show how it could control somebody. And the story is a good story, but unfortunately the misrepresentation of hypnosis has then carried into other films, and people have seen this, and then they associate that with what happens on stage when a person does something very funny, unusual, and they assume he's being controlled by the hypnotist, when of course this is not the case.
So basically what we're saying here is that the relationship between the therapist and the client will play a major role on the trust. Can you talk a little bit about that, how a professional hypnotherapist would be acting as a therapist, and how would we reassure?
Well, of course, firstly you deal with the fears, because they can't trust you if they really don't trust the state that you're going to work with them. Now, the therapist builds a relationship based on trust, which is having a benevolent authority position, that you know what you're doing and that you're benevolent in what you're doing with it, that you have your skills and your knowledge and your use of hypnosis and so on. And then that builds rapport, which is one aspect of building the therapeutic relationship, which is a special therapeutic alliance developed for the purposes of therapy. So if that's put in place, and you've explained about hypnosis, the myths, the misconceptions, the person then is ready to accept going into hypnosis, and they realize then they're not losing their control. Of course, once they've been through it a few times with you, they become very confident and really get to like the state and to use it then for themselves.
Great, thank you. Some other common myths which I'm starting to hear as I'm getting more and more involved in this field is that
Sure.
people think he's going to mesmerize me, he's going to do with his hands all kind of funny stuff, he's going to use a pendulum on me. Can you speak a little bit about Mesmer, what he did, and how different and how similar we do today, and also did he have a total success rate, Dr. Mesmer?
Oh, well, Mesmer was the predecessor to our modern form of hypnosis, but we credit him with introducing a form of psychological therapy outside of a religious context, a spiritual context. So Mesmer is a very important figure. He's often, in my view, misrepresented, misunderstood, but his ideas were different to what a lot of people at the time, as medicine was becoming more scientific, that they didn't want to take on his theories of animal magnetism and so on. And that's a complex phenomenon, this animal magnetism he talked about. But anyway, he used passes, and these were passing the hands over the body to generate, to activate the flow of the energy through the hypnotist channeling this energy, like electricity, through the client's body and hoping to re-establish a healthy flow of energy. And there's a two-way flow between the energy of the therapist and the client. Mesmer believed in the crisis. This was an important part of the healing to bring things back into alignment. We can go on a long time about Mesmer and his theories, but his ideas were discredited by people who felt there's no basis for this, of course. The debate still goes on. Is there an energy force involved with this?
Like meridians, chi.
Yeah, and Mesmer had complex ideas. He thought this was a scientific discovery, not a metaphysical phenomenon. But then how you distinguish the two in this case is a bit hard to say.
And the truth of the matter, the case from history showed that he did help people heal often.
Yes, of course. Mesmer's, the commissions that investigated his work, they found the results were true. The incredibly successful results he was getting with people. He was a charismatic individual. He had some of the very good qualities of a therapist. He was accused of being a showman, and that certainly had a flair for the theatrics. But he was accused of many things, of being after money and so on. There seems to be an awful lot of professional rivalry and jealousy in many of the criticisms of medicine of Mesmer. I've done quite a lot of study of the reports of the time, and of course he wasn't the easiest to get on with. He seemed to be a complex personality, but if you look at what he did, the results were real, and the commissions concluded that, even his worst enemy, so to speak, but they said it was being done through imagination, or in some cases, well, yes, there was charlatanism involved. People were being paid to say they were better when they weren't better. There's very little evidence of that I can see. So, as we now know, if you activate the creative imagination within people, many psychosomatic illnesses and diseases of various kinds can be helped. So we would now say that much of what Mesmer said could be done with the power of the mind, can happen, but he believed in animal magnetism. He did have spiritual views himself, but he didn't feel animal magnetism was some metaphysical energy.
Interesting.
Interesting, complex issue that.
I've got a question,
Sure.
if that's all right. So from Rene, he says, tell us about hypnosis in the medical world. Where is it used? How is it used? And where can we expand the use of hypnosis and hypnotherapy?
Perfect. So we just had a question. Our friend Yazir is reading to us from Rene about hypnosis in the medical world. John, can you talk about that a little bit?
Well, there are many doctors who have been using it back from the time of Mesmer. Mesmer was a physician, and so many doctors of the time who were open-minded to his work began to follow in his path. ever since then, it's been on the periphery of medicine. It's been used for pain relief. It's been used in psychosomatic medicine. That means, where there's a strong emotional component in the problems. Many gynecological problems have that. Many of the skin rashes, skin conditions, certain of the bowel conditions, overexcitation of the bowel or causing the bowel to become underactivated. Now we know breathing, we have nervous asthma, the old term for it, nervous eczema, as one of the skin conditions. Many physiological states that are unhealthily working in an unhealthy way, as we call disease. Hypnosis can be valuable there, very valuable. And so doctors have used it and are increasingly opening to it now. Sometimes we're not using the term hypnosis because back to the misunderstandings and the myths again, and the debates about it. We call it guided imagery, visualizations, and medical relaxation, and so on. Or mind-body medicine is now becoming a term to describe this general field. So it's here to stay, I think, now in medicine. And hopefully we as practitioners, if you're not medically trained, you can use it in conjunction with the medical treatments that are being given. And it can help people deal with the use of drugs where, let's say, they're becoming over-dependent on pain medication. It could be used in conjunction or as a substitute where that's appropriate and necessary. People can be trained through self-hypnosis to help their own physical conditions. And so it's very important for them, for each client, to get a good understanding about the applications and the scientific basis of this as well, the research that exists. Hypnotherapists need to read up on this and make sure that they can convey good, accurate information to people.
That's great. Thank you so much. And in fact, you have specialized courses and classes on medical hypnotherapy.
Absolutely, where we look at a wide range of conditions where hypnosis can be used very, very effectively, and helping immune conditions, helping respiratory conditions, cardiovascular conditions, blood pressure, and so on. And we're not saying it's a substitute for medical treatment, but in conjunction with it, as many doctors do and have been using it now for a long time.
It's a positive supplement of medicine.
Absolutely, a wonderful supplement to the human body. You're learning to use your mind to boost your own natural healing mechanisms, which after all is what medicine relies on. Medicine stimulates your system with the medications and so on, but it's your body does the healing ultimately. And so we can do that for ourselves also to add to the medical treatments that are being given.
Perfect. Thank you so much. Just because we're on medical and I'm very passionate about one of your old friends, can you say a word or two about Dr. Jack Gibson?
Oh, Jack Gibson was a very talented, skilled surgeon, an Irishman who worked with hypnosis in wherever he worked medically from the time he was quite young. And
because he also worked in Africa for quite a few years.
Yes, he found that a lot of the time he didn't have medical supplies for pain relief for people who were injured, and so he would use hypnosis to help them. And over time he began to use in conjunction with drugs for where people had chronic pain conditions, and teaching them sometimes where they were becoming addicted to the opioids to use their mind instead, where the problems were becoming very, very severe with the dependency on the drugs. Jack worked in several countries in his life, and worked in a hospital outside of Dublin, where he was in charge of accident emergency treatment. So people coming in who were badly injured and waiting for their bodies to process something they'd eaten or were going to sort of stomach pump them. It wasn't the easiest thing to do. He decided he would hypnotize people straight away and get to work with surgery. Get on with his surgery work. And he would hypnotize them and do the surgery. And he did that for thousands of cases. He was a most remarkable man in terms of these personal qualities as a physician. So very interested in people and very committed to doing the very best treatment for people, which is why he incorporated hypnosis. He ran many classes that they were, because he taught himself hypnosis in his house, no charge to patients from the hospital, where they were learning to use hypnosis for breathing problems, gut problems, and so on. But as a surgeon, and this is something not enough people really know about it, he is the most, I think, the person who's used hypnosis the most in surgery ever in the history of medicine.
I know. It must be him. But there's still people doing it in Belgium, I believe. There's a French professor.
Well, yes, nowadays, I suppose they have done quite a large number by now, so maybe they have done more at this point. Jack did many without any anesthetics.
Yeah.
They use in conjunction hypnosedation, which is wonderful.
Absolutely.
And helping people then, instead of having a general anesthetic, having a local anesthetic plus hypnosis.
And much less of the toxin that comes with anesthetics,
yes,
because it is a drug.
Instead of the rigours of a general anesthetic for an elderly person, would say. People would say a lot of medical conditions and having a lot of medical treatment, a lot of drugs in their system, instead of having to, again, use a general anesthetic, using a local anesthetic and hypnosis for quite a lot of surgeries. They do a lot of work with endocrine surgeries, thyroid work and so on. So that's wonderful. I'm always thrilled when I see people learning how to use it in medicine, doctors and surgeons and anaesthetists learning about it. We teach a course in that as well. I've taught plenty of doctors and surgeons about pain control over the years, and that use is becoming more well known.
So we've got another question.
Another question, guys. Yes.
From Daniel, who asks, where do you see the future of hypnotherapy is going? And with regards to legislation and regulation.
Perfect. So thank you so much, Daniel, for that question. John, if you can answer that.
Well, hypnosis is growing and growing in the medical world and outside of the official healthcare professions, right? The licensed professions, we call them in America. It's growing and the future is very bright. I think the thing that people do need to know who are looking for hypnotherapists is that therapist well trained. We've had a lot of influx of people into this field who may or may not be the most interested in the hypnotherapy itself, as opposed to we were just commenting on some people in the classes yesterday where I was teaching a clinical hypnotherapy class, saying how they spend a lot of money for very inadequate training. And so that issue then of regulation, what are the standards that are appropriate for hypnotherapy to become a hypnotherapist or to train people to become hypnotherapists. If you're working with the public, you need to know what you're doing. You need a good training course. And the standards are being developed, being developed. I first started getting involved in 1984, which in the modern era I think was when I put together a meeting with other people up in London, and we had 32 trainers come together to begin to set standards for training. And we've had a lot of debate and discussion since then over the years, and some standards have been worked out. So that is a first step. By no means are those standards universally agreed. They do not have some kind of government oversight and regulation of that kind. Government says, get on with it. Yourselves have self-regulation. The government does not want to regulate this field. But there are one or two organizations that do give a kind of a semi validation for what we do as with standards. They say these meet minimum requirements, right? But the optimum standards for hypnotherapy have yet to be developed. Regulation is a two-edged sword. One positive is, of course, the public have more trust, and the trainee student can have more trust in what is being offered. The downside for regulation hypnotherapy could be that it simply gets taken over by another senior profession and is seen somewhat as it's just a tool of medicine that then can only deal with certain conditions that other people tell you it can be used for. By that I mean each profession has its own territory, and if at the moment when we have a fair amount of freedom of creative development of the profession, when you get into the hierarchies of power, you've got to be careful, because other people tell you what you can and can't do based on their territory, their desires and so on. Now that's inevitable, and it's not all wrong or evil or anything. It has to be worked out. So I think, but it can be very unhealthy. At one point, for example, there was a very strong debate in America. No doctor could use hypnosis unless he was a psychiatrist.
Wow.
So doctors had to fight to train, to get good training in hypnosis so they could use it in conjunction with medicine. We can see how unhealthy that law was.
course.
And then certain people in the medical profession didn't want psychologists using it. But now clinical psychologists and well-trained psychologists use it very effectively. So this is what happens when turf battles begin and take time to sort themselves out. So I think we do need a standards of regulation in hypnosis that is voluntary self-regulation, but has oversight as well, meaningful oversight from government that people can look at, the public can look at and say, oh right, this person is well trained, and that helps protect them from the charlatans.
Absolutely. So thank you so much for watching and listening, guys. I would just like to comment, you just completed a course yesterday, which I attended. It was the clinical hypnotherapy course.
Yes.
Can you say a few words, a few highlights about the course? I would like to start by, this course was very much focused on analysis. It was very much focused on understanding the client's needs. And working together with the clients to a better resolution and a brighter future for them.
Yes.
It was done in a very different way. As you know, my background is psychology, some counseling, and it is, I don't want to say the word instant, but it's very quick method of getting a person on the right track and starting to march towards the freedom, the confidence, the empowerment.
Yes.
Can you say a little bit about more in depth, how come it's so different, and why is it not popular like counseling, like CBT? How come it's such a niche? It's such a shame for me, seeing that it's in the margins of therapy and not at the head and the forefront of the. It's a bit painful. Can you talk a little bit about what it's so different and why it's still in the margins?
All right. Well, the approach that I teach is based on a lot of experience and training with other people as well. It's the quickest, best, most powerful form of hypnotherapy I know. That clinical hypnotherapy course, of course, teaches us about inductions and deepening, giving programming suggestions, but it introduces the student to the whole field of analytical hypnotherapy, how to get to the roots of issues, where cognitive methods are not enough. So you use cognitive methods, there's in-depth counseling skills involved. That course taught, as you saw, a great deal about how to focus in on the client.
Yes.
So it's very client-centered, so you've got a great deal of attention skills, observation and listening skills that are emphasized, non-verbal and verbal communication, so you keep reflecting back. It's very dynamic, as you notice. It's all very much in the now, so very existential in that element of it. Also very focused on not making just theoretical judgments about what's happening, just dealing with what emerges. So that's where the hands-on interactive work needs to be done, to find where the client is really stuck, to get to the emotions that are blocking them, to then get underneath that to the fixed ideas, which are really deeply held beliefs, which of course in cognitive therapy they're trying to find those dysfunctional thinking patterns. The problem is they're very, very deep in different parts of the brain, as we now know about how the brain processes experience. So you can be talking about the problem and saying, how it affects you and how I'd like to change it, but this other part of the brain is not engaged with that really. We go to those areas of the brain, get in there, and you can see how dramatic it is when some of the emotion comes out. It's very dynamic. And I'm not saying it always has to be screaming and roaring with emotion, but if you don't change the deep scripts of what has become the problem area of their life, in that area of life at least that's holding them back, they don't change sufficiently.
Yeah.
And so it's not a miracle, magic wand. It's very focused, based on a lot of work of ego state therapy. It's an integrative approach. It comes from many strands of psychotherapy and hypnotherapy. And remember, hypnotherapy is the origin of psychotherapy and encompasses all aspects of the mind and all aspects of what we now call psychotherapy. But it goes beyond the talk element of psychotherapy alone, which tends to take a long time talking about it with the hope, and often it's a hope, that the person will let go of the past and change those patterns, which may or may not happen and sometimes doesn't.
Thank you so much for that. There was a book which you recommended during the class, which is really what that therapy is. It's a transforming therapy.
Yes.
And can you just in few minutes, very short few minutes, talk about the founder of Transforming Therapy, a little bit about the story, and if somebody wants to get the book, where they can get it, because it's a very special book, and it's not. I think every person that interested in therapy and interested in in developing themselves,
Yes.
should look at it, and then the next course that people can come on, because it's very, very important.
Right, that book, Transforming Therapy, was Gil Boyne's manual. It's a training manual. It has case studies which go with certain training DVDs that you can look at, those videos where Gil is working with clients with specific issues. It's got principles of transforming therapy, a lot of information that's very important, valuable to therapists, so it's a wonderful book. It can be got through Westwood Publishing, which is our specialist publishing house for the work of the masters. And now the approach of transforming therapy, which you've been asking me to say a few words, has many strands to it. It largely has come from the work of Dave Ellman and other important pioneers in our field who developed hypnoanalysis to a very high level. However, back in their day, back in the first half of the 20th century, Freudian models of the unconscious dominated the therapy world. And even the hypnoanalysis was rather tied to some of those concepts and ideas. The field of Gestalt and some of the other integrative approaches had not really yet developed, which of course have come out through hypnosis. Fritz Perls was a hypnotist. As I mentioned, the class hypnotist for 9 years. He was a psychoanalyst as well. He was very skilled and knowledgeable in hypnosis. But you couldn't use that word in the official world of psychotherapy and psychiatry, or at least being seen as a hypnotist caused a lot of opposition to your work getting accepted. Hypnosis was always considered too directive, which is of course a big misunderstanding. That's another myth of conflicting ideas among professionals. They think you can't use it because it's directive. It's a misunderstanding. Anyway, back to this field that was developed then in opposition to Freudian thinking of the subconscious. Gil Boyne trained with many, many eminent psychiatrists, psychotherapists, and in particular he worked in running encounter groups, Carl Rogers groups. He taught with Shostrom, who was the man Dr. Shostrom was a person who ran an institute doing a lot of teaching of Perls's work, so Perls and Shostrom worked together. Gil trained with Shostrom and worked there. He trained with Alexander Lowe in bioenergetics and many, many people. So his knowledge of psychotherapy and psychology was very profound. And his knowledge of hypnotherapy was very profound because, of course, Gil learned hypnosis at quite an early age and practiced as stage hypnotist for 3 years while still being a therapist during that time. He started training people in 1956. And so taking all the knowledge and skills that he had learned, he put that together into what's called transforming therapy, the brand of therapy, which is the foundation of modern analytical hypnotherapy. It's often misunderstood. There's people teaching little bits of it, sometimes in an inaccurate way, not understanding properly, not having proper training in transforming therapy. But Gil's work has been continued to develop. I taught with him for a long period of time, and during that time, and he only passed away in 2010, so he continued to think about and develop and learn more and more about the human mind, which is really infinite in its capabilities and the levels and aspects of the human mind. So Gil was forever thinking and developing the work, and we continue to develop and expand transforming therapy. It's very deep, very comprehensive, and that course was just the introduction to it.
Wow.
How to do an interview based on transforming therapy. How to really learn the skills of observation of the deepest kind and uncovering and bringing up the material that you need to work with. We have an advanced analytical hypnotherapy course in May, which then teaches you how to really break down the material from the subconscious, to go in there and start to change it, re-educate the subconscious, and add a whole lot of new understandings at the conscious and subconscious level, bring very powerful integration. And then you can do wonderful programming because you know where their issues really are, what they're really coming from, what they're about, as opposed to what the client will initially tell you, which is the surface level of the problem. It's important, but you haven't got the deep material yet.
Guys, it was an incredible course. I cannot recommend it enough. It was life-changing to be there, to see John at work, the things I saw there for regression, for the interviewing technique, for unearthing information of what might be holding the clients back in their life, in their progress. It's phenomenal. So John, thank you so much for all of that. And for those interested, the next course, which is the first course in the series.
Yeah, the very next course is in March, 4th to the 9th of March, and that's called Hypnotherapy Skills for a Life Change. It's a course that teaches people about hypnotherapy, whether they're going to use it for their personal lives or whether they're going to learn to use it to become a therapist or in conjunction with some other profession that they work in, medicine, psychology. So it's a wonderful course of teaching you about your own mind, how to use that first so you can then work effectively with other people. That's a very core part of hypnotherapy. The therapist must know how to use the mind to help themselves. There's no point in being a hypnotherapist who still smokes, is grossly obese. If you can't use it very well for yourself, you're going to limit yourself in your ability to help other people. So that's important. It's a wonderful course, not because I say so, but because the knowledge has come from many, many sources, plus my own experience.
Of over 40 years.
Yes, well, 38 years professionally as a registered practicing hypnotherapist. Before that, I did it for about best part of 8-9 years as well, and but that I consider that was my early learning.
And you studied as well psychotherapy?
Yes, trained in several forms of psychotherapy.
You're a clinical psychologist?
Clinical psychologist country means you've done a very specific kind of course training. Academically, a psychologist, I've taught psychology many years in the university and other settings. I was chief medical psychologist, and I've certainly been a psychologist, and I'm a psychologist in one sense.
Amazing. So guys, you really cannot get any better training. I recommend it to absolutely everyone and anyone, especially if you're a therapist, you want to take your training, you want to take your success further, come and join the course. If you're a youngster, we're starting to see more young people joining your course now. I think those social media videos are really getting out there and people are spreading them, so thank you guys for doing that. And in the recent course we saw some young people which were just interested in self-development, and
yes.
they study your work, and they decided that this will be the right route for them, and incredible to see what they got out of it.
Oh yes.
It's
remarkable. They were delighted. People's response was phenomenal. But they saw other people. We had 4 cases I did in the class of people's issues, taking them back to childhood scripts, taking out the fixed ideas and helping them change them. Yeah, it's very powerful, amazing work, and anybody who learns enough about hypnotherapy can do the same.
Absolutely, and I'm one of them. I went there with an sort of open mind. I'm still my background is psychology. I'm an atheist, so I wasn't 100% sure, but somebody really recommended, a good friend of mine, a doctor, pushed me to take the course. And it took a lot of persuasion, because I'm a person that doesn't take courses lightly, and I have to, and because hypnosis is not very well known out there, not very well studied, I thought, you know what, he has great reviews. I know a guy that studied the full diploma with you, is a transforming therapist now, and he pushed me so much, and I done it, and it was the best thing that I've done. It's incredible, so empowering, so it's really special. It's really special for me personally, with my ill health conditions. Some of you might have heard, I've got chronic fatigue syndrome, severe IBS, fibromyalgia. To being here today, comfortable, got up here early, it makes a real change for me, and it's all down to John techniques of hypnosis, of self-hypnosis. He taught me in the mornings when I feel the chronic fatigue is strong, the fibromyalgia. In your mind, get yourself on a bicycles in a warm place and slowly start cycling. And when you do that in your mind, your blood starts to flow, as in the mind, as in the body in a way. And before I know it, I can take the duvet on my own. People with fibromyalgia, it's a real struggle. It's something that it's not in our head. It's the body is really struggling, but the head has the ability to change it. So John, thank you so much for that. Thank you guys for watching, and I look forward to seeing you in the next video.
Thank you. Thank you all for watching and listening.